about COVID. I think as just at least personally, living in an Indian household, having Indian parents, I have heard everything that I never even thought of that I could hear about this virus, preventative, like all these myths. And so I'm excited to talk to each of you to get your take on what, and dispelling some of these for the audience, because my dad has definitely sent me a few of these secretly. He constantly WhatsApps me and spams me. So I'm really, really interested to get a medical opinion just for my own personal sake. And then I'm taking all this conversation back to my dad and just being like, stop watching WhatsApp. So we'll kick this off. I'm an auntie to a lot of children, and especially I have a lot of friends that have healthy kids, and then I have some friends that have kids with asthma. And one of the myths that is consistently kind of circulating in our circle is that kids don't get COVID. So if Dr. Anita, if you want to address this particular myth, I'm personally very interested because that's what I've personally believed and heard, that kids don't get it and it's not a big deal. So I would love your take on
I would love to talk about it. So I'm Anita Patel. I'm a double board certified pediatrician and pediatric critical care doctor, and I work at one of the largest children's hospitals in the country. So hopefully I can debunk a little bit of that particular myth. So as of today, there's been about 3.5 million cases of COVID in the country. We all know that. CNN's going, in the background of most of our homes. And 200,000 of the 3.5 million cases, around 200,000, are children. And so that's important to know. So and if you read different reports, different databases, about 6.5 to 7.5% of all cases of confirmed COVID have been children. So first and foremost, children absolutely can get COVID. And what we know from actually other countries, particularly China and Korea, that are doing much more widespread testing than we are, is that a lot of these kids don't even have symptoms. So although we have 6.5 to 7.5 confirmed COVID cases in our country, us as pediatricians truly believe and pretty much know that there are a lot more cases out there that haven't been even tested for. And a couple of other stats that I think are important to know are that of the 200,000 kids that are getting COVID, about 5% of those kids are actually getting hospitalized. And 3% of those kids are ending up in the ICU or getting cared for by people like me. There is silver lining, though. That's a small percentage of patients, and the mortality rates are really low, meaning the amount of kids that end up, unfortunately, succumbing to COVID has been the highest rate. The highest reported number is around 0.2% of all deaths are in children less than 18. So there is a silver lining. The adage that COVID doesn't affect kids, I hate that phrase, but what I will say is it does look like, in general, kids are not as affected as adults. We're not seeing the same numbers. We're not seeing the same severity overall. But you know what? You don't want that 0.1 or 0.2% to be your kid or your niece or your nephew. So that's sort of my general response to the whole kids can't get COVID. They absolutely can.
And maybe I'll just follow up, because this is a conversation I just had this afternoon. What is the guidance around COVID with children that have a pre-existing respiratory condition? For example, asthma or any number of these things. What is the guidance for parents with that situation at hand?
Yeah, so in any children, so what we know, there was a meta-analysis, basically pooled data of all the COVID studies in children. And what we saw in that study was around 60 to 70% of the kids had a pre-existing condition, uncontrolled asthma being a risk factor. Now, if you have well-controlled asthma, you don't have reasons to think that you have increased risk of COVID, but again, the data is not great, and but you're absolutely right. If you have any pre-existing condition, particularly if you're on any immunosuppression, they are representing a larger proportion of the COVID cases. So, one thing I would say with parents of children, and we talk about asthma because asthma is so widespread in kids. So what I would say is that if you have a child with asthma, make sure you're following their asthma action plan. Make sure that they're getting their medications when they're supposed to. If you do all those things, these kids should do okay. So that'd be my biggest piece of advice.
Yeah, and that leads me into one of the things that is constantly a problem for adults and children, probably more children, because I particularly don't feel like that comfortable wearing a mask. And I guess the other myth is that you can't really breathe well in the mask. So what's your take on that? And I know personally it took a little bit of getting used to, but I'd love to hear your take on the actual breathing process.
Absolutely. So breathing is one of my specialties as a critical care doc, so I feel very passionate about this. So first of all, the cloth mask that most of you, like that I'm wearing out in public, and even a surgical mask that we wear in the hospital, carbon dioxide is a teeny tiny particle, and that's what we blow out. Oxygen, also teeny tiny particle that we blow in. The masks are designed to allow those teeny tiny particles to go in and out of the mask. The point of the mask is actually to catch droplets. Like when you sneeze, it's kind of gross, but we all know when you sneeze, you see little droplets go into the air and on your hands, etc. That's what the mask is supposed to catch. It absolutely is not catching the particles that we're breathing in and out. And in fact, for the most part, the mask that most of us are wearing in public, the cloth mask, there's also air, there's space on the sides, guys. That's all great space for us to practice gas exchange. Now, that's with the caveat that children under 2 are not supposed to wear masks because there's a suffocation risk. Adults with, that can't use their arms and remove that mask also are not supposed to wear the mask. There's lots of, children with developmental delay, even if they're older than 2, are not supposed to wear masks. So there are certain populations that we're not recommending wear masks for good reasons, but most of us, it's not going to impair our breathing, and if we feel suffocated, we can remove it right away. So truly, you can breathe with the mask. This is someone that studies gas exchange for a living. There's no issues. Wear a mask.
Yeah, that's pretty cool advice. One, because I think personally I was a little confused, even though I wear a mask regardless. I do as I'm told because I'm like, what's the harm? But I think you made a really important distinction between droplets and breathing, right? Because droplets are larger than air particles that we're breathing. And I think that's a very important distinction that it just kind of clicked for me. So definitely another reason, pro tip on the wear the mask.
Good, wear your mask.
Great. Well, speaking of masks, N95s, we have, from the beginning of this pandemic, N95, if you didn't know what they were, you definitely do now. And if you didn't, you're probably living under a rock. So N95s have made headline news. I recently saw a TikTok video with, the N95 and saying that, it's the only most effective mask and that blowing out a candle through a mask is possible. Dr. Amani, could you address this TikTok video? Because I know you also did a little demo behind that, in response to that TikTok video, which is very cool, by the way. I've never tried to blow out a candle with a mask. There's a lot of new things that I've been trying to do with a mask, and including trying to drink rosé. But anyways, for another topic. So, what's your take on the N95 and then, all these crazy TikTok videos that I've been seeing?
So I'm Amani Jhambekar. I'm a breast surgical oncologist, and I practice in Houston, Texas. I'm a surgeon, so I wear masks every day, all day.
So you guys have all seen the viral TikTok trend where people try to blow out a candle through various types of masks. But what most people don't consider is when you have COVID, you're coughing or sneezing, not actively trying to blow out a candle. Check out what happens to the flame when I'm right next to it and I'm coughing or sneezing. Achoo! Achoo! Masks are more protective than you think.
I made that video just to demonstrate that even if you are wearing a cloth mask, like it is much more protective than people think. I think initially in the beginning of the pandemic, we had a huge problem where everyday people were going out and buying N95s and hoarding them because of videos that were saying that you're really not protected unless you wear an N95. And even though now there are some studies that are showing that it may not be a droplet situation, it may be that the virus is airborne, there have been plenty of other studies that have shown that masks, even a simple cloth mask like this one, will reduce transmission by 80 to 90%. And in fact, I'm sure many of you have read this. There's a story about two hairstylists in St. Louis or in Missouri, and they actually cut hair for like 140 people, and everybody whose hair they were cutting, and the stylists themselves were all wearing masks, and no one actually developed COVID, and those two hairstylists were positive and cut hair of 140 people before they realized it. So it just demonstrates the power of a very simple protective face covering and why everyone really needs to wear one.
Yeah, thanks for the clarification. My follow-up question, I have seen, I'm in Atlanta, and growing up, I'm going to link this to something very funny, because growing up, wearing your pants around your waist was optional. People took liberties on where the waistline was. And here I am, 20 years later, I've spent a few weeks here, and I think that's the same thing with masks. I've seen them here, 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 just dangling on the arm. I have seen everything. Where does a mask need to be for it to be effective? How should one wear it?
All right, so this is why I brought my little cloth mask. So here's my little cloth mask, which I got from Old Navy. I'm putting it on. The loops need to be around your ears, and it needs to be covering your nose and your mouth. If your nose is out, it's not doing anything. If you're wearing it as a chin guard, it's not doing anything. If you're wearing it around one ear, which I've seen, and I've seen the arm dangler,
Yep.
like you've seen,
like a purse.
it's not doing, right, it's not doing anything. And like, you can go back and say like, oh, well, how did I catch that infection? I was wearing a mask. Well, you weren't really wearing a mask if you're wearing it like this. I have this conversation all day, every day in my office, because I treat patients who are on chemotherapy who are more immunocompromised than the general population. And many of them come in wearing their masks underneath their noses. And if you have that problem because you're wearing a surgical mask and the loops are just too big, you can tie a knot to make the loops smaller, very simple, or you can just buy a mask that has adjustable ties, so that way it doesn't keep slipping down under your nose. Because then when it keeps slipping down under your nose, the other thing you do is you keep touching the outside of it to pick it back up. And touching the outside of it and then touching other places in your face, that actually increases your risk of catching the infection.
Yeah, great thing, and thanks for demonstrating how to put it on. Could you also be so kind to share with viewers how one should safely take their mask off when you come back from a public place? Because obviously our fingers, early in the pandemic, I was wearing gloves. Now I just keep sanitizer on my hands, and I'm obviously very aware to not touch my face. But when you're taking or putting the mask on and off, if you go to 2-3 stores in an afternoon, there's risk. So I would love to know what the safe way of, removing the mask.
So I'm putting it on again, and I put it around my ears. Whenever I take it off, I grasp one end, and then I bring it off like this. I'm holding it, I'm dangling it, I'm not touching the outside of it, and then I'll put it to the side. Like if I'm gonna go to multiple places and I'm gonna wear the mask again, I'll usually put it down on like the floor of, the car seat next to me so it's not touching other things, and then pick it up the same way just by the ear loop and put it back on like this. The main thing is to avoid touching the outside of the mask because you don't know what things that mask has already blocked and what's already out there.
Yeah, very helpful tip. And that is something that when I had gloves on, I mean, they were going everywhere. So it's definitely a learned behavior in our new normal to properly handle your hands and properly taking the mask on and off. So thank you for that. The next myth is something that we have very heated debates about in my house with the family in India. So I'm going to let Dr. answer this question. Something about, and my dad and I just got into it, like that the virus doesn't live in hot climates, and everybody's been waiting for summer. This is what I hear on, like, I eavesdrop on the calls. And it's like, oh, I spoke to so-and-so in India, and like, we're just waiting for summer, as if miraculously this is just going to disappear once, and we're in the summer and we still have a virus. So could you address that myth for everyone listening that has family in India?
Yes, absolutely. Well, so the way this myth came about is because the flu, right? We worry about the flu in the winter because flu is from the influenza virus, which is seasonal, but the coronavirus is not seasonal. And in fact, there are still coronavirus outbreaks in very hot climates like Florida and Texas and even India. In fact, my parents called me, hi mom and dad, the other day and were very upset that Amitabh Bachchan and his whole family have gotten coronavirus. So guess what? If you're arguing with your family, the best way to tell them is, look, even Amitabh Bachchan got coronavirus, and it's so hot in India right now, and it's still viable. So also, yes, there is some thought that maybe the viability of the virus is a little less stronger, but that doesn't mean you can't get infected. So you still need to follow all the precautions that we were following in the winter with coronavirus. So staying 6 feet away, wearing a mask, washing your hands for 20 seconds, all of those things you still need to continue to do even in the summer. It is warm wearing a mask on your face in the summer, and I get it, it's hard, but you need to commit to it for your health and for the public health. There are people around us who are going through chemotherapy, who are who are on medications that cause their immune system to be lowered, and we need to protect those people. Those are somebody's family, somebody's sister, somebody's kid. I mean, we got to protect our community as a whole, and I think that this is why we're here doing this. It's just so important to debunk these myths.
Yeah, and it's to me, it's such a small price in the grand scheme of this pandemic. To do your small part, right? Like, I mean, it's similar to recycling, it's like putting a seatbelt on. These things are inherent to our daily lives now. And I think, yes, the first couple of months were a little rough, right? But now I don't feel weird. I'll be very honest. Like the first couple of weeks when I was the one person that would go to the airport and be like, oh my God, here's the Asians like wearing the mask, right? And it feels weird when you go out in public to wear a mask, but now everybody's doing it, Now I don't feel comfortable I don't feel comfortable if I don't have a mask on, similar to getting in my car and not putting on my seatbelt. So yeah, it's very, very important. And thank you for, I guess for me clarifying the fact that it is not a seasonal virus. It is a completely different strain, and so seasonality has nothing to do with it. I guess on the topic of India, we wouldn't be Indians if we didn't have a quote unquote eat this, open that, take this, do this 5 times, go in circles. We have traditions and rituals for everything. Everything can be cured from our cabinet. And the other thing that I heard, so-and-so got COVID. Well, they're not Indian. They don't eat turmeric and fill in the spice, what have you. This is and these are real conversations I'm eavesdropping on, okay? That the people that aren't eating turmeric are the ones that are more likely to get COVID, and therefore, if we eat turmeric and spices, we're not going to get COVID. Dr. Anita, please. This is a few things that I know about. I know there's so many medications and including someone saying Lysol in the body will help rid of this. So I'm going to leave it there and let the
So first of all, even though I've been in school, I went to school for 15 years. As soon as COVID became a clear issue, my mom sent me, hi mom, if you're watching, by the way, sent me YouTube videos on ginger and honey, ginger and turmeric, and said that this prevents and cures COVID. So first of all, I don't want to poo-poo the Indian, we all know turmeric has great anti-inflammatory properties. However, is there any association with prevention or treatment of COVID? Sadly, no. I wish there was, but there isn't. And it goes beyond that. So first of all, are there any FDA-approved medications to prevent and or treat COVID right now? No. Unfortunately, no. Now, there are supplements that we think of that may have some preventative properties in general viruses. So I wanted to address a couple of them because these are probably supplements that many of our viewers are taking right now. So the first one is zinc. So I think zinc is sort of all over the news. And why is it all over the news and why are people paying attention to it? It's because we know that zinc does have some effects on preventing viral replication, meaning sort of the virus reproducing in your body. And we do know that it can prevent certain viruses from replicating. Now, do we know that this has any effect on COVID currently? No, we do not. Are there harms to taking zinc? Well, so zinc is what we call like a trace element, and it's the second sort of biggest trace element in our body. There can be harms to taking zinc, so I wouldn't tell everyone go and take zinc. And again, we don't think that it is preventing COVID. Now, I would say talk to your doctor if you're starting to feel sick, and talk to them about zinc. But would I tell the whole world to go and take zinc? No, and we don't see that there's no association between it currently preventing or treating COVID. So that's the first one I'd like to address. Vitamin C. So as a critical care doctor, vitamin C is near and dear to my heart because we do have 1 or 2 big trials showing that it can actually help with certain viruses. And there's actually a couple studies ongoing with COVID. Now, when I talk about vitamin C, though, I'm talking about big doses through IV or an intravenous line in your body. So there is no way that anyone is going to go take enough zinc orally to prevent or treat COVID, and so far there has been no proven benefit to doing so. And I would never recommend anyone going home and taking a bunch of vitamin C. The likelihood is you're going to get really expensive pee because you're going to pee it out. And also there's harms to anything we do. So unfortunately, also with vitamin C, hopefully these studies will prove something, but as of right now, there's nothing going on with that. Now, vitamin D, that's a big other sort of element, vitamin that people are going crazy over. And the reason is because there was a couple early studies showing that maybe vitamin D deficiency has an association with sort of worse outcomes in COVID. But those are really problematic studies because vitamin D deficiency is also really common in patients that have lower socioeconomic status, that are of certain ethnic and racial groups that we've already proven have a higher rate of developing COVID. So there was the studies that were done on vitamin D deficiency and potential development of COVID weren't necessarily perfectly done, but there are studies being done now to see if there is sort of a benefit to taking vitamin D. So again, unfortunately, none of these studies have proven anything, and you know, doctors say this all the time, but for good reason. Don't take any of these supplements without talking to your doctor, because there can be benefits, but there often can also be harms. And if we could tell the public that there was a vitamin to take to prevent COVID, do you think that not every single doctor would be standing on their soapbox screaming to go take it? Of course we would. And there are doses also, and I'm not going to tell them here because there are doses based on age and weight, etc., that you're supposed to be taking for all these vitamins too. So don't just go on Amazon.com and buy all of them today, because you could be overdosing yourself. So that's all right. It's my little soapbox, but I wish I could tell you there was a good prevention. There isn't, and unfortunately, I wish I could say turmeric prevented it. Unfortunately, I cannot say that.
Well, mother is going to be disappointed, but we'll live. This brings me to something that I'm embarrassingly going to do, perfect strangers, because I swear I have done this. And when I saw this on the myth list, I was reluctant to bring this up, because for years, in the winter, every time I feel run down and I feel like I'm going to get the flu, I start gargling salt water. Because in my head, I have been told somewhere down this like rabbit hole that it prevents bacteria from spreading. And I don't know if it's psychological or what, but I do it, and I do it every winter. And every time that I'm not sick after that, my brain has linked an association that this is what I need to do to prevent myself from getting sick. So Dr. Amani, please don't embarrass me, but could you answer if there's any merit to my salt gargling? I didn't do it for COVID, in all fairness, but I promise if I like felt a little tickle in my throat, I definitely would be in the kitchen faster than I could blink, heating up the water and like loudly gargling like our Indian uncles. So help us understand. Gargling, yes, no?
So actually there is some merit to gargling with salt water when it comes to symptoms of a cold. It may alleviate some of those symptoms of having a sore throat. In terms of, is it going to decrease the duration of that cold, and is it going to do anything for COVID? I don't think so. And there's no data that has really supported gargling with anything, not hydrogen peroxide, not salt water, not anything that's going to actually prevent a COVID-19 infection or reduce the severity. And so I do think that if it's something, if you have a cold, at this point it's kind of difficult to tell whether or not it's a cold or if it's something else.
Right.
I would say that, I mean, you're welcome to do it if it makes you feel better, but it's certainly not going to prevent you from developing a nasty COVID infection. And I would say that if you're having any of those symptoms, it's best to probably go and talk to your doctor right away at this time, rather than trying to do some of those home remedies to kind of try to alleviate things, which we might have done, a year ago when it was safe.
Yeah. And I will, there are a few questions coming in, particularly to Dr. Anita. Would you like me to address those before we move on to my myth-busting list?
Why don't we go through the myths, and then I promise we'll address the questions at the end.
You got it. Okay, so carrying on, back to Dr. Amani. And when we first had this conversation about me moderating this panel, I was thinking like, I haven't really heard that many myths, right? This is the first thing that I thought of. I was like, what myths? I'm like, yeah, I've heard a couple. And then when I started reading it, I was so embarrassed. So another true story, a friend of mine went to a party, and they were passing around something to put underneath your nostril so that it would prevent, I guess, the droplets from, it would just give you a protective barrier underneath your nostril. And everyone got some at the party so that they could potentially preventatively or preemptively kill the bacteria while they were all not social distancing. And then I read that there's coconut oil in this whole mix. I don't really know what they gave out at the party, but that is a myth that I heard, and I thought, how ludicrous. But somewhere it started. Somebody went online and bought the stuff, and then other people agreed, and these are educated people in New York, agreed to smear things underneath their nose, in the hopes of not getting COVID. So does it work?
No, I mean, I agree with you completely on that. It does not work. I've seen people rub things underneath their nose. I've seen people recommend rubbing coconut oil into your nose. All of these are just ways that you're going to touch your face more, and touching your face, there's good data to suggest that will increase your risk of getting a COVID-19 infection. And especially if you're at a party and someone's passing something that they've touched their face with, and then you're going to touch your face with the same thing, and you're going to get all up in here, that is bad news. That is a great way to catch COVID-19. So if anyone passes anyone anything at a party that's been on their face, I recommend you do not touch that. You say, hey, I'm sorry, I value my life. I'm not going to do that. And I believe in science, and I understand that there's a lot of different things that we're hoping are going to be able to help us. We're all hoping for a magic cure, a magic prevention. We're all hoping that this is going to end because it's been 4 months already and it's miserable. But anything that you have to apply on your mucous membranes, into your mouth, into your face, that's especially been touching someone else's face is certainly going to increase your chance of getting COVID. And at this point, we don't really know, you can probably catch COVID a second time. Having antibodies is not really protective, so it's not even one of those situations where if your friend went to that party and then unfortunately did catch it, they won't catch it again. And so I would say that kind of putting anything on your face is really high-risk behavior that we probably want to stop that myth right here.
Well, I'm not naming it, but I promise you this, after this call, I will drop a nice, polite message that says, stop it, it doesn't work, and you're putting yourself at risk. Very good. Now, obviously, a topic that's near and dear to my heart. This is the first of its kind that I've heard, because while I've heard everything with regards to homeopathic remedies and things to eat and do the circles and what have you, everything that Indians believe, the myth on this list about cold foods preventing the virus, really, it blew my mind. Number one, because I couldn't understand how are those two things correlated? And because the other things kind of made sense to me, this one had me a little missed. So Dr. Rena, can you help me understand cold foods and why, and who came up with this idea or myth?
Yeah, so I think, again, I don't know who came up with it, so I can't claim to know exactly what they're thinking, but my thought is that they're thinking that it's actually going to change their core body temperature, and so that will help fight the vaccine. However, very simply, this doesn't work. Putting any food in your body, any supplement, anything, food, drink, all the things we've talked about, they're not going to prevent COVID-19. Basically, but when you do get food, so when you get food from the grocery store or you buy some food, or even if you get it delivered, you want to make sure you clean the contents that come in. So we at our home have a process where we get the food, we wipe everything down, we throw all the bags away, or we put them in recycling, depending on what kind of bag it is. And we make sure everything is clean before we then go cook with it, touch the outside of it that's been touched by other people to prevent getting the virus. And in addition to that, you should be cleaning all your surfaces at home, because the virus can last for, up to several days, depending on the type of surface that you have. So you should be, getting the doorknobs and the faucets and the highly touched areas, as well as your cell phone. So make sure you clean your cell phone with some approved cleaners. and go and look. They should be EPA certified cleaners, and they're safe, whatever are safe for electronics, but you should be cleaning all those surfaces that are frequently touched, because that is what spreads COVID-19.
Yeah, the phone one is really, really key, because along with the mask thing, the first thing you do, whether you're in the grocery store or you get in your car, you're doing this number. And I bet you our phones are probably the most filthy thing that we own, next to our shoes. I'm not kidding. I and I early on have been making it a regular process of at least wiping down my phone at least every 2 days if I've gone out. If I'm home, it doesn't really matter that much, but the wiping the phone is a big new behavior that I've learned, and something that I'm trying to just ingrain, similar to the hand washing and the touching the nose kind of thing. Well, this brings me to the last myth. Had to practice up on my Punjabi a little bit, because I get spammed. I'll go back to the original thing that I began with. My dad is on WhatsApp. He calls it WhatsApp, first of all. It's not WhatsApp, it's WhatsApp. And he's constantly, I have him because I cannot stand the number of videos that come through. Like, he gets them from India, then they come into my inbox, and I just happen to click on this thing about onions, and like, I think I made out, it's in Punjabi, but I made out some of the thing about eating the onions with some salt and water, something of the sort. But I know red onions were involved. And I was like, again, how did this food thing get into preventative? Because listen, I have 2 pounds of onions downstairs right now, red onions, to be very specific. If this works, I will go and get them, and I will do whatever it takes. Yeah, but I think I made out the gist of the video, and I think that's what he was kind of, aiming to communicate, is that something with red onion, salt, and water, and maybe consuming it. Can you shed some light on that?
Yeah, absolutely. So I saw the video. It is in Punjabi, and I am Punjabi, so I can translate. But essentially, it's you cut up raw onion, you serve it with salt, and you eat it. And then half an hour later, you drink water, and then you are, protected from COVID-19. And I've seen this one, and at least my mom thought it was a joke, knew it was a joke, and so sent it to me because it was hilarious. But I think, again, this goes back to nothing you eat is going to prevent COVID-19. And so, doing all the things that we've talked about to prevent from COVID-19, wash your hands for 20 seconds, sing the ABCs. Make sure you get this part of your hand. This part we often forget. So wash your hands really well before you're eating, before you're going, every time you've done something that's somewhat dirty, you've gone outside, wash your hands. When I come home, I know all my doctor friends come home, we all have like a decontamination procedure. So I don't touch anything. I take off all my clothes. They go straight in the wash. I go in the shower before I touch my kids, before I talk to anybody. I am, completely undressed. My shoes stay outside. So these sorts of things are really important. It's figuring out what you need to do in your home to keep yourself protected when you come from outside. If you've interacted with anybody, even with a mask, I would recommend that, you really shower, clean off your body really well after you come home. Stay 6 feet away, wear a mask. Both people should wear a mask. If someone is coming to you without a mask and wants to talk to you, I know it's uncomfortable to say, can you please, I can't talk to you right now, but this is your health. People are dying from COVID-19, and you need to just feel comfortable to say, I'm sorry, this is not appropriate. If you'll wear a mask, I'm happy to continue this discussion. And if not, I have to excuse myself. And then, again, I think those are the big things that we all have to do. Please reference the CDC and the WHO website, and check out their website. They have really great up-to-date information with evidence-based data for everybody to see. That's really easy to read for all of our viewers. And I'd love it if Dr. Patel and Dr. Jhambekar could say anything I might have missed.
I definitely agree with everything you're saying. I think that Even in my field, there's other physicians that have tried to come up to me and try to actually shake my hand. And it's very uncomfortable to be like, no, thank you, sorry. But I do, I back up. I say, well, if you're not wearing a mask, if you want to touch me, that's just not going to fly. I take care of immunocompromised patients. And I think that, yes, it is kind of awkward, but it's better to do that than to risk the alternative. And, the person who gives you COVID-19 is not going to feel bad about it. They're not even going to know about it because they may have given it to 100 people that day. It's going to be you that feels bad because, you're sick at home or, worse, a family member is in hospital, something like that. So the best choice is really to just not let anybody else infect you and just protect yourself.
Yeah, I totally agree with both of what you guys were saying. And, one thing I didn't mention is I have a new 3.5-month-old at home, and I'm back in the ICU. And I actually, Amani, you had mentioned you use your patients as your reason, even though, let's be honest, ourselves should be a good enough reason. But, it is awkward. So what I found is I prepared myself when I went to work. And whenever, people were all wearing masks, thankfully, but I do think that the space issue and the hand hugging / handshaking issue is a thing. And I am a hugger pre-COVID. So I made a big stand when I came in and people came too close to me. I was like, guys, I'm just going to take a few steps back. I have a newborn at home, and again, we shouldn't all have to have an excuse, but I do think it helped me to be able to say sort of a tangible thing that people understood. So, just as a little maybe get out of jail free card, it's nice to have something like that.
Yeah, I think in general, you shouldn't have to state a reason. The pandemic is reason enough to exercise that. And in the defense of someone else, sometimes we do default to our old behaviors because this is not natural, right? When we see someone, it's just so natural to want to go up to them and be close to them. So I think it's on us if we are to take a stand and for everybody's collective health, and to mention that. And maybe someone forgot. Like I could very easily forget what 6 feet is like. I'm not, walking around with a ruler. And so it's nice to just be politely reminded, hey, I'm going to just take a few steps back, and as nicely as possible. It's the new place we are in, and I think the sooner that we get comfortable in that, and it's not to offend anyone. We're dealing with people's lives, and there shouldn't be any offense taken to that. So thank you.